Good day, everyone. My name is Loya Ying, and I'm a moderator. Welcome to our panel discussion featuring distinguished professionals in the healthcare leadership arena. We have a diverse group of experts with us today, each offering unique perspective on the challenges and strategies associated with leadership, collaboration, and communication in the complex healthcare landscape. Thank you for joining us today as we delve into the intricate world of healthcare leadership. In the evolving landscape of healthcare, effective leadership is crucial for achieving optimal patient outcomes and navigating the complexities of the field. While numerous studies have explored broader aspects of healthcare leadership, our research aims to shed light on a critical yet understudied factor: the dynamic interplay between small team communication complexity and leadership efficacy. Healthcare organizations are increasingly recognizing the pivotal role of leadership in enhancing operational efficiency, ensuring patient safety, and fostering a collaborative culture. However, the unique challenges faced by leaders in small healthcare teams, where communication is both heightened and constrained, warrant further investigation. Today, we are honored to have Shiro, a seasoned healthcare professional, with us. Shiro, could you please provide us with an overview of leadership in today's complex healthcare landscape?
Yes, in the realms of healthcare leadership, our overview underscores the critical roles of leaders involved in all facets of healthcare. As the report emphasizes the importance of small team communication complexity and leadership efficacy, and will share about perspective alike with the acknowledgement that effective healthcare leadership is vital for achieving optimal patient outcome and managing the intricacies of the field. The emphasis on a patient-centered approach, teamwork, adaptability, and ethical decision-making in my position alike with the report focus on the dynamic nature of communication within small healthcare teams. Critical recognize of limited resource and a complex regulatory framework resonated with the report and knowledge of challenges in small teams where communication is both increased and contracted. Furthermore, Danira will share her insight into the future trends shaping healthcare leadership such as digital health integration and population health management alike with the Young report recognition of the importance of technology and strategy for effective communication within small healthcare teams. In enhanced Naziha position provide a comprehensive understanding of the multifaceted role of healthcare leader, emphasizing the need for knowledge, adaptability, and effective communication, qualities that are critical in addressing the announced challenges highlighted in this interview. The integrity and area perspective and the report's finding underscore the intricate relationship between leadership communication and success patient outcome in the complex world of healthcare. That's all.
Thank you, Shiro. Next, we have Anne, an expert in team collaboration. Anne, based on your experience, could you share some specific strategies or practices that can foster effective collaboration within small teams in the healthcare setting?
Okay. Based on my experience, I think open communication is crucial. We need to feel comfortable to share our insight and challenges without hesitation. Also, clear roles make a difference. Knowing who is responsible for what ensures we are all on the same page and can act swiftly. We could also have a monthly recognition program, acknowledge individual contribution. It will boost morale and create a positive atmosphere. These strategies will undoubtedly strengthen our collaboration and enhance patient care. Other than that, it is important to make a regular team meetings. Regular meetings will help us stay informed and connected. Then, we could schedule joint rounds where representatives from different departments come together to discuss patient cases. This way, we ensure a holistic approach to patient care. Then, interdisciplinary collaboration is at the core of healthcare. And let's not forget continuous learning. Maybe we could organize periodic training seasons or workshops sharing the latest research findings and advancements. It keeps us all updated and sharpens our skills. That's all from me. Thank you.
Thank you, Anne. Turning our attention to communication, we have Kriva, a communication specialist. Kriva, in the dynamic nature of healthcare communication, how do you suggest healthcare professionals adapt their communication approaches to effectively convey information across different stakeholders and contexts?
Thank you for providing me with the opportunity to share insights as a communication specialist in the dynamic field of healthcare. As a communication specialist, I view communication dynamics as the interactive and evolving essence of the communication process, marked by fluidity, complexity, and constant change. This concept captures the intricacies of interactions, emphasizing interactivity with a continuous feedback loop and the necessity of adaptability. Communication, linked to a collaborative dance in healthcare, is a synchronized routine that adjusts to the changing rhythm of information flow within small team dynamics. This analogy underscores the importance of collaborative interaction, incorporating nonverbal cues into a symphony vital for effective teamwork. The metaphor of a melody signifies the dynamic shifts in communication tone and content, while recognizing the crucial role of continuous feedback in facilitating understanding and promoting harmonious leadership. Thus, embracing the dance of communication in healthcare is characterized by being dynamic, collaborative, non-verbal, contextually adaptable, and finally attuned to the needs of our impactful teams. So, referring back to your question, in the dynamic landscape of healthcare communication, adapting communication approaches is paramount for healthcare professionals to effectively convey information to diverse stakeholders and also the context. A key strategy is tailoring the message to specific needs and understanding of each audience. For instance, when communicating with patients, employing plain language and visual aids can enhance comprehension. In discussions with fellow healthcare providers, utilizing medical terminology and evidence-based data may be more appropriate. When engaging with policymakers or the public, emphasizing the societal impact and relevance of healthcare policies can foster support. Furthermore, leveraging various communication channels such as the digital platforms for younger demographics or town hall meetings for community engagement ensures the message reaches its intended audience. Ultimately, maintaining empathy, cultural competence, and patient-centered approach will bolster effective communication across the diverse spectrum of healthcare stakeholders and situations. And that's all from me. I'll pass back the stage to the moderators. Thank you.
Thank you, Kriva. Our next expert is Danila, a leadership consultant. Danila, as a leadership consultant, what advice or methods do you offer to healthcare leaders seeking to shape and influence their teams positively?
Hello, I'm glad you reached me out. Shaping a positive and effective healthcare team involves a combination of leadership principles tailored to the unique challenges of healthcare environment, especially in the small team communication. First, we have a lead in empathy. Start with a democratic empathy and understanding toward the small team members. In healthcare, compassion is crucial, and leaders who show the genuine care for their team foster positive and supportive work environment. Then we have effective communication. We each establish a clear and open line communication. Clearly, accurate expectations, share the information transparently and effectively. Listen to the small team members. Encourage an open dialogue to create culture where everyone feel comfortable and express their thought and concern. Then we have inspire share vision, which is a clearly accurate, compelling vision of the future. Inspire a small team by aligning their words with a meaningful infection vision. In healthcare, a shared vision to improve a patient outcome can be powerful motivation. Then we have a promoting collaboration, which is a foster a collaboration and inclusive a small team culture, encourage interdisciplinary collaboration, recognize and appreciate the diverse skill and contribution of each team member. Also, we have a provide role opportunities, which is support professional development of team members, offer training, mentorship program, and opportunity for the skill enhancement. Investing a small team growth, benefit for the both individual and overall strength to the healthcare team. We also have a prioritize a work-life balance, which is acknowledge a challenge strategies in a healthcare setting to create a healthy work-life balance for your team members, which is considering a reasonable work hours and provide a mental health resource. Last but not least, we have a lead by example, which is a model to behavior expectation from the team. Demonstrated resonate a strong words ethic and communicate to the value healthcare provision to the action, set the tone of for the team and influence the organization culture. That's all from me as a leadership consultant. Thank you.
Thank you, Danila. Now I will let the next moderator continue our discussion.
Okay, thank you, Yaying. I'm Apsarina, and I will continue with the questions. Okay, now let's hear from Prof. Najiha, a healthcare communication professor. Could you elaborate on the unique challenges and complexities that arise in communication within small healthcare teams, and how can this challenge be effectively addressed?
Certainly, I'd be happy to elaborate further on the unique challenges and complexity in communication within small healthcare teams and how these challenges can be effectively addressed. First one is interdisciplinary collaboration. The challenge is collaboration among professionals from different disciplines such as nurse and allied health professionals. Can be challenging due to varying perspective approaches and priority in patient care. By implementing interdisciplinary rounds where team members from different disciplines discuss patient case and can enhance collaboration. Second, professional variation. The challenge is healthcare teams often consist of professionals with diverse roles such as doctor, nurse, therapist, and administrative staff. Each role has its own set of responsibility, language, and priority leading to potential miscommunication or misunderstanding. Third is urgency of patient care. The challenge is timely and accurate information flow is crucial in healthcare, and any disruption or delays can impact patient care. Information silos where critically details are isolated within specific department or individual can hinder effective communication. Fourth is hierarchical structure. The challenge is in healthcare organization can create communication barrier with lower level staff sometimes hesitating to voice concern or idea to a higher ranking professional. To addressing this challenge, we need to establish a culture of open communication regardless of hierarchical level in culture. Encouraging feedback, implementing regular check-ins, and providing avenue for anonymous communication, if necessary, can empower all team members to contribute to discussion and decision-making process. Lastly, technology integration. The challenge is introducing and integrating new communication technologies can be met with resistance or difficulties in adoption, leading to potential disruption in information flow. To addressing this challenge, offering comprehensive training programs on new technologies, addressing concern and involve team members in the selection process can enhance the successful integration of communication tools. So that's all from me. Thank you.
Thank you, Prof. Najiha. Turning to our communication strategies coach, Kartini, what practical strategies can be given for enhancing communication within small healthcare teams?
Well, thank you, Apsarina, and good day, everyone. As a communication strategies coach, I am delighted to share my insights on practical strategies for enhancing communication within small healthcare teams. Effective communication is crucial in a healthcare setting, and these strategies aim to foster collaboration, improve information sharing, and create a positive team environment. Firstly, regular team meetings serve as a cornerstone for open communication and collaboration. By scheduling these meetings, healthcare teams can discuss ongoing cases, share updates, and address concerns. Actively encouraging participation from all team members ensures that diverse perspectives are considered, leading to more comprehensive decision making. For instance, in a recent study, hospitals that held regular team meetings experienced a significant reduction in medical errors, emphasizing the impact of open communication on patient care. Secondly, the utilization of technology plays a pivotal role in enhancing communication efficiency. Implementing secure messaging apps or collaboration platforms facilitates seamless information sharing among team members. It is essential to ensure that all team members are proficient in using these tools to prevent communication gaps. For example, a hospital implemented a secure messaging app resulting in quicker response times to patient inquiries and a reduction in instances of miscommunication. Thirdly, defining roles and responsibilities is paramount for small healthcare teams. Sorry. By clearly outlining each team member's role and establishing a chain of command, decision making becomes streamlined and task responsibilities are clarified. This approach minimizes confusion and enhances overall team efficiency. A clinic that implemented role definition observed a decrease in task duplication and an increase in overall productivity. Moreover, fostering an environment of constructive feedback is crucial for continuous improvement. Conducting feedback sessions to identify areas for improvement and celebrating successes creates a culture of learning and growth. In a case study, a nursing team implemented regular feedback sessions, leading to increased job satisfaction and a noticeable improvement in patient care quality. Lastly, investing in training and skill development programs is vital for enhancing communication skills within healthcare teams. These programs should focus on effective listening, empathy, and culturally competent communication. By improving these skills, team members can enhance patient interactions and teamwork. A recent initiative in a hospital involved ongoing training in communication skills, resulting in improved patient satisfaction scores and better interdisciplinary collaboration. In conclusion, effective communication within small healthcare teams is achievable through regular team meetings, technology utilization, role definition, constructive feedback, and training programs. By implementing these practical strategies, healthcare teams can create a collaborative and positive environment that ultimately benefits both team members and patients. Well, that is all from me. Thank you.
Okay, thank you, Ms. Kartini. Building on that, Alia, another communication strategist coach, can you give tips about fostering collaboration, active listening, and adapting to various communication styles within healthcare teams?
Thank you, moderator. So, firstly, tips for fostering collaboration, active listening, and adapting to various communication styles. Firstly, is establish a collaborative environment. We need to encourage team members to express ideas without fear of judgment, valuing diversity of thought, and emphasizing the importance of everyone's contributions. Next is promote active listening. We need to emphasize active listening, encouraging full attention, feedback, and the use of techniques like paraphrasing and summarizing, confirm understanding and value, diverse perspective. And then adapt to communication styles. We need to recognize and appreciate diverse communication style within the group, being adaptable to individual preferences. Last but not least, use technology effectively. Utilize communication tools and technology for collaboration, particularly in virtual settings, using platforms like video conferencing and messaging apps. Lastly is provide constructive feedback. We need to cultivate a culture of constructive feedback, encouraging positive and support sharing of insight. So that's all from me.
Thank you, Ms. Alia. Okay, our final expert is Mr. Ziang, a healthcare quality improvement specialist. In your role, Ziang, how do you assess the impact of effective communication on patient care outcomes, and what measures or initiatives do you suggest for improving communication in healthcare settings to enhance patient care?
Sure. Regarding your question, I get the relevant information from published report from hospital, review given by patients, and news reports. This results channel has been researched and highly reputed. From the information gathered, I analyze how effective small team communications can lead to good outcome for healthcare. This aspect includes the ability to reduce medications error, timely diagnosis and treatment of patients, increase patient specifications. Let's say, small team communication allow team members gather together to discuss problems faced by patients to prevent misunderstanding during treatment. Being able to have clear handover, standardized protocols, and active listening can minimize misunderstanding during treatments. It can reduce medications error and increase patient satisfaction. In addition, small team communications between doctor and nurse can help doctors obtain timely and accurate information about the patients. The information about the patients and past medical history can assist doctors in identifying potential problems early and implementing appropriate interventions. Okay, next, there are two suggestions to improve small team communications to the healthcare setting. One is the new patient-centered care model, because this model has been successfully implemented at Taiping Hospital. This model emphasizes hospital create a small team communications between patients and healthcare providers to encourage patients to express their concerns and to participate in making decisions about their care. The second approach is the Transitional Care Management (TCM) program. In this program, doctor will create a small team communications meeting to improve care coordinations and communication between providers during the critical period after a patient's discharge from the hospital. This is my point. Thank you.
Thank you, Mr. Ziyang. Okay, so as we draw our discussion to a close, it's evident that effective communication is the cornerstone of high-quality patient care and positive outcomes, particularly within small healthcare teams. The dynamics and a complex nature of communication in interdisciplinary teams offers both opportunities and challenges that skilled leadership can adeptly navigate. Establishing regular team meetings, defining clear role expectations, investing in training, and leveraging technology are strategies that enable open information sharing across diverse roles. Fostering collaboration, honing active listening skills, and cultivating cultural awareness are essential in adapting to different communication styles within small teams. When transparency is prioritized, it facilitates timely diagnosis and treatment, reduce errors, enhance patient engagement and satisfaction, ultimately leading to improved health outcomes. Therefore, we underscore the importance of strong yet flexible leadership to cultivate a cooperative environment where communication seamlessly flows, optimizing safety, efficiency, and the delivery of care. Thank you to our esteemed panel for sharing your expertise, and thank you all for joining us in this insightful discussion. That's all from me. Thank you very much.